Good afternoon. It's Rita at the Travel Nurse channel. It's Tuesday and it's the 6th. It's my grand canine, my daughter's dog. It's her birthday. Little Prim, she's 9. So that is also an occasion for me to remember my mother's had her stroke now for 9 years, and she's just such a trooper. She's 91 years old. I hope you're well, and I have to say I was running around a little bit today, and my first trip to a mall. I went to a mall to get some jewelry fixed, and I didn't get some jewelry fixed, but I got my husband some shirts, and I got a gift for a friend, and I got myself another pair of jeans. Another year, another pair of jeans. So I hope you're all well, and I sometimes, so the Travel Nurse channel, let me just give that little clip about who we are and what we're about. The Travel Nurse channel is a meeting place and a site for anybody that does healthcare travel, anybody that employs a nurse or any of the allied fields, a respiratory therapist, a MRI technician, an occupational therapist, etc., all the allieds. So if anybody uses travelers, and a lot of healthcare venues need them, such as hospitals and clinics and long-term facilities, etc. So we are here to bring all these groups together. I'm not a travel company, although I ran a travel company, and I more of a per diem company. But I did some travelers. I had nurses travel from California to Arizona, from California to New Jersey, and from different parts of California to other parts of California. So I did work with a lot of travel nurses when I had my agency, and but mostly I was doing as needed staffing. So hospitals would need extra ER nurses or extra telemetry nurses for the night shift, or CNAs, or all that kind of stuff. That's what I did. But this Travel Nurse channel is really just a meeting place for those that travel, that want to travel, that need to employ travelers, and I'm hoping, the goal of it is to eliminate a lot of unnecessary time and effort that goes into it. So I see ads all the time from wonderful companies, big companies, and they're advertising for a job, and you fill out an entire requisite for it, and nobody even gets back to you for days and weeks and months. So I think what's happening is that there's some types of recruitment that utilize the internet and put a lot of things on there, and sometimes they're current and sometimes they're not, or the ad is running in so many places you think they needed 100 nurses and they actually needed 1 or 2. So it's confusing and time consuming and so forth. So I'm hoping and I reach out to recruiters and employers to contact me at rita@travelnursechannel.com or at 800-737-6518. Anytime. I'd love to talk to you and let you know more about what we're doing here. Thousands and thousands of interested nurses and techs and therapists and doctors, and they're here regularly because we're here. I'm here doing a video every Tuesday and Thursday, sometimes with a guest. I haven't had a guest in a while. I guess I need to put a little more effort into that. But the video is here and the site is here nonstop. The videos happen on Tuesday and Thursday from 2 p.m. to 3 p.m. Pacific Standard Time, and it's live. So you can check in with us, come to our link, say hello, tell us what's going on, how you feel about traveling, how many travelers you've used during this COVID crisis, and so forth. So I'm going to get a drink here. Enough about the Travel Nurse channel. Let's get on with the topic. And that's another thing. I approach different topics every time. And then sometimes people will stream in and ask questions. And so I try to answer them. And if I can't, I'll do it in the very next video. I'll do some research and hopefully come back with an answer that is helpful. So today, pain. I was thinking about pain. I've experienced a little bit of pain. Well, a lot. Now it's down to a little because I very badly broke this wrist. I'm so excited. Tomorrow's my first occupational hand. I'm going to meet with a occupational hand therapist. I'm so excited. I actually know her. I socially knew her. I'm looking for a Kleenex, so I'm going to have to just itch my nose and then wash my hands. Sorry about that. I don't know why I'm always itchy. It's very dry. I live in Southern California. We're generally well under like 40% humidity. We have a low humidity level, even though we're close to an ocean. Pain. So, and all kinds of pain. I think I'm really focusing more on physical pain when I speak to pain, but there's emotional pain and psychological pain, and there's psychosomatic type pain. But I'm really, what I'm really addressing is just the pain, feeling pain and knowing what to do about it, or observing pain as a practitioner and knowing what to do about it and assess it. And I posted something today. I thought it was wonderful. It came from, I think, Purdue University. Their lead nurse, one of the a doctorate of nursing, was talking about how nurses discern pain in their patients, and they become quite skillful at it after a while, because we're great observers, nurses. We become very, very keen observers, and be careful of that when you get really busy. I've talked about how sometimes we get task-oriented and the patient feels left out of the picture. So make sure you always look at your patient when you're talking to them. If they're anxious and so forth, you can touch them on the shoulder, you know, or someplace appropriate on the arm maybe, or the hand. If it's appropriate, you know, it's COVID now, so with clean hands, you know, clean gloved hands, freshly gloved hands. But nurses have a responsibility to help patients. That's what we're all about. And oftentimes it's difficult for different reasons. So patients can be shy, patients can be distressed, patients can be uncertain, and culturally they may be stoic, or they may be big crybabies. No, that's not an appropriate way to say that. They just may be hyper anxious and hyper excitable about pain. So I'll explain what I mean by that. So in my career, I did a lot of bedside nursing and a lot of clinical nursing with patients, direct care, and I loved it. Started in the 70s, and to this day still I do some, not so much clinical, more volunteer at this stage, but I love nursing. It's part of who I am. Okay, so for example, I would approach a patient. It could be a patient of 17, could be a patient of 97, and let them know that the doctor has ordered some medication and they're going to be getting an intramuscular injection, and that I would be giving it to them, and I prepare them and so forth, and I tell them about the medicine and the effects and the side effects, etc. So they're prepared, right? I tell them maybe that when I greet them in the morning, or when I get the doctor's order at 10 o'clock, and the medicine is due within the hour. So I come back within the hour, and you know, I may have a tray, or I just may have an alcohol swab and my and my injectable in my hand. And so, oh, hello. Oh, thank you. MD Moklasur Raman is saying, hello, ma'am. I look fresh and good. Well, aren't you the sweetest person in the world? Thank you. Thank you. I feel fine. I feel fine, actually. Yeah, and I'm going to talk about some of my pain control with this little fracture and how I'm managing and so forth. So I'll give you some personal information. But I'm talking about pain and discerning a pain when you're a nurse helping a patient. So now we're talking about, you've explained to, doesn't matter the age, 17, 27, 47, 97, you've explained to the patient how you're going to treat them and that they will be getting an injectable. And it's probably penicillin or whatever it is, right? Let's say it's penicillin. And so you explain to them that they're going to get an injectable. They're already in a fear mode. They don't like needles. They don't necessarily faint, but they just don't. Nobody likes anticipating pain. And so you go to your patient, and preferably they're lying down. You roll them to your side. You're going to use a gluteus muscle or a lateral muscle in their thigh or their hip. You know, all good places. You want to go to a place where you can really reach the muscle well, and they're not too bony and so forth. And if, particularly with penicillin, it's a lot of medicine, so you don't necessarily want to give it in the deltoid. So anyway, you get in there and you greet your patient and say, you know, I've brought that medicine that the doctor wanted you to have. Let's turn you on your side. Maybe it's in a clinic situation, so maybe they're standing. You have them lean on a table or, you know, somewhere, and drop their drawers. And before you do anything, you might be just tearing open the alcohol prep swab, and they're jumping or they're yelling. And I would put my hand on their shoulder and say, are you okay? I haven't done anything. I'm merely getting my little towelette ready to give you a little cleanse the area. They're just in a panic. So pain, nobody likes it. Nobody likes anticipating it, and so forth. And I'll tell you a trick I use. I often use this. I will, you know, nurses, you should call in, because you all have such wonderful tricks of the trade that are helpful. And I know you've dealt, if you're an ER nurse or any kind of nurse at all, a CNA, I know you've dealt with patients with pain. I know you've done a lot of hand holding and treating and medicating. I know it. But I'll tell you a little trick I learned along the way. I don't know where I learned this, but I started doing, I gave up a lot of vaccinations at one point too. So, and then I was a dialysis, needles and me, we're old pals. And when I was a kid, I got a lot of needles for allergies, which my mother called them a tick-tick, and a tick-tick sounded fine. I never had a problem. But anyway, so I'll use my hand, pretend it's a muscle, and I would swab the area really, really well. And say, okay, say I'm going to make a mark. Oh, God, I wonder how long that's going to be there. So say that mark is where I was going to give the needle, right? So I let my patient know. Now I'm going to use a pointer. So I let my patient know it's time for their injection. Let's see, is that a better way? And I clean the area. And just before I inject right there, oh gosh, it's so hard for me to, just before I inject right there, with my other hand, so I would have two hands, I would just give a little, with my tip of my finger, and I have short fingernails, I would just clean, clean, clean. Okay, here we go. And I would tap with my finger near where the injection goes in, and then inject. And that's my trick. I don't know how I developed it or when or why, but oftentimes my patient go, well, I go, okay, put a Band-Aid on it and whatever. They'd be going, when are you going to give me the injection? I'll go, we're all done. Because maybe they felt me cleaning, and they felt the little tap, you know, near the site. wherever I put it, and then the injectable went in. So just be conscious of your patient's pain, and the fact, the fear of pain is almost as bad as the pain, and that's part of the way. I apologize. Why I always have a tickly nose? I wonder, there's dust in my ceiling? No. Nah, there's no dust in here. There might be a little dust in here. Okay, so washing my hands again. So anyway, that's just one little facet, is that patients anticipate pain and have anxiety about it, which makes it worse. Then I was mentioning Purdue University, but I don't have a copy of that. Do I? No, I don't have my phone with me. So this this nursing president of Purdue University Nursing School was talking about nurses and their skills and their compassion and all of these things. And she says they become, their discernment for what's going on with their patient becomes very astute, and it does. And so when we go, maybe we're going to a post-surgical patient. Let's say we're dealing with an inpatient. And we could be dealing with somebody in long-term, somebody that has a lot of chronic pain, all kinds of pain. But let's just take a scenario. You're a nurse and you're dealing with somebody with acute post-operative pain, and you want to help them, and you want to stay, what we say, is ahead of the pain, because if the pain becomes too severe, it takes longer to control it. So you go to your patient and you introduce yourself. It's the beginning of your shift. You know when they last were medicated. You know when they'll be able to get any medicine, and you're assessing them. And one of the signs you're assessing them, one other thing that you assess besides their skin and their color and their breathing and their vital signs and so forth is pain. You have to assess pain. So you check the surgical site. You let them know, I'm going to check your surgical site and so forth. And as you're assessing them and getting them in a relaxed state and getting them to trust you and appreciate that you're there to help them, you ask them about their pain. And they say, oh, it's okay. I think the night nurse gave me a pill or put something in the bottle. And as they're saying that, you see them grimace. My pain is okay, you know, and you see frown lines, and you see twitching, and as you maybe say they had a hip surgery, and as you move the covers and broken hips, broken bones hurt, they do, and they do a lot of manipulating if they're replacing a hip or fixing a hip and so forth. So as you move the covers, you see them tense up. I mean, you see all kinds of things. You see white knuckles, you see frown lines, you see straight lines or maybe frowny mouths, you know, and yet they're saying to you, no, I'm okay. I think the night nurse put some medicine in the bottle or the bag or whatever. And so now you've discerned that they have pain and you suspect it might be higher than a 5. So now I'm going to pause and talk about the pain scale. And most people in healthcare know about the pain scale. And I think for children it might be different, but for most people it's 1 to 10. Travel Nurse Channel, I am a little nervous about doing a travel. I have experience, but I'm accustomed to a certain pace, but I would like to venture out. I think you should, and a little nervous is a great thing. We'll talk more about that. Thank you for checking in. They didn't leave a name, but thank you for checking in. Right now we're just going to talk about pain a little bit, and then we'll talk about being nervous about doing travel, but you want to do it, and I'll talk to you a little bit about it. So So the pain scale, most of us are aware of it, but we don't look at it very often. And certainly a patient that has maybe no healthcare background and is suddenly finds themselves acutely ill or has appendicitis or whatever, and you show them a pain scale, you should show them a pain scale because it helps. So one, it is a tolerable pain, 1, 2, 3. Yeah, I kind of feel it, and maybe it's not so short, maybe it's dull, and it doesn't hurt if I sit still or whatever. But 5, it's starting to be a bit more. Now you're not smiling anymore. You can't grin. Now you're in a straight line. Now it's like, I think this is getting kind of difficult. And then above 5 and towards 10. That is pain that must be treated. You don't want pain to get up to 6 without treatment. Hi, somebody checked in. Razak Abdur, hello, ma'am. Let us know the amenity for the travel nursing. The amenity? You mean how much they get paid? Amenity. Why is that amenity? Yeah, amenities. Amenities. Okay, amenity. There are more. Yes, there are a lot of amenities for travel nursing, so we can talk about that as well. So pain, you're not only going to treat the pain, but you're discerning that what the patient is saying about the pain and what the reality of the pain is are two different things. The patient is frowning in their mouth, and you see lines here, and tensing their knuckles and tensing their body, and maybe I'm okay, breathing, rapidly and so forth. So now you have to teach the patient. You would say to them, gently, of course, there could be cultural differences, whatever. You would say to your patient, you say your pain is under control, but let's talk about what kind of control you should have. And you explain to them that for healing, there should be some control of the pain, that you want to keep the pain at 5 or less, right? You want them to be able to sleep well and move, and if they're eating, to eat or drink. They need to be able to do these simple activities of daily living with that pain under control. And if they let it go beyond the 5 or 6, then it's much more difficult, takes more medicine, and it can hinder the healing process. So you've explained that to them. Then you maybe show them the pain scale, the 1 to 10, and say, pick a picture or pick a number, and then we'll talk about it. And so use your skills of discernment to help your patients with pain, because it's maybe not something they've dealt with very often, and they're in a different environment. They're in a hospital or a long-term facility environment. Things are different, and they think they're just going to let you do everything, but they actually play a part in their treatment and their recovery and their healing. And so we are their nurses, we are their teachers as well. So let me go back to this anonymous person saying, I'm a little nervous about doing a travel. I have experience, but I am accustomed to a certain pace, but I would like to venture out. Okay, that's great. That's all good information. And you may find the perfect travel assignment, and you say, you're nervous? Well, it's good to be nervous, because if we're a little nervous, we usually do a pretty good job, we show up early, we review things, and so forth. You say, I have experience, but I'm accustomed to a certain pace. So I wonder what that pace is. You have experience where? A certain pace. Do you work in a clinic? Do you do wellness checks? Do you do vaccinations? A certain pace. I work in a long-term facility, and my pace is that I have time for all of my patients, and I care for seven or more patients per shift in my skilled facility, and I work with a team with an LVN and a CNA. So whatever that pace is, whether you work in a clinic, whether you work in a long-term facility, or maybe you work in an ICU, and you usually do one-on-one and maybe 2-on-1, depending on the acuity of that ICU patient. So whatever the pace is you are accustomed to. Oh, somebody else is checking in. MD Moklasur, can RNs make six figures? And what type of RN is the most in demand? Okay, we'll talk about that too. And Anonymous is asking for ICU and ER. Oh, I'm nervous. I have experience, but accustomed to a certain pace in the ICU and ER that I work in. Okay, but I do want to venture out. Okay, so this is something good. This is a good thing. You know what works best for you and how you work best. You know, you're happy with your environment. You're happy with your pace. And I imagine no matter what ER or ICU you work in, that pace is a relatively busy pace. But then there are levels. There are ER levels. So you probably don't want the trauma. So you know, all right, you're telling me by what you've written here, and thank you for checking in, even though you're anonymous. That's fine. That's totally fine. You already know who you are, what you do best, and you want to go try a travel assignment and venture out and see how that goes. And I think that's great. So you do a little research. There are very many travel companies out there. And so maybe, and there are the top 10, and I've talked about who the top 10 are. I could look them up right now, but I'm not going to do that research where I could do that again. But you could archive. Travel Nurse Channel, you can go through the archives, and there's usually titles for each video. So it might be titled, top 10 travel companies. So you could find that there. But you would look at some of the travel companies and maybe pick one big one and one smaller one, right? And decide where you want to go. If you're from a big city, maybe you want to try another big city. Or maybe if you're from a more rural area, you want to stick with that, so you want to go to a more rural area. But then you communicate with your recruiter. Say, this is what I'm looking for. This is the hill I'm going to die on. I'm an ICU patient, and this is what I do every day. I need a pace very similar to that. Or I'm a long-term nurse, and this is the pace I work at, and I deal with 7 to 10 patients a day, and so forth. So you find a good match. Something to consider too, if you've never traveled before, is that most companies, most facilities that the travel companies are working with do require a certain amount of floating. So find out about that. Find out what you feel or you believe you're qualified to do, and say, yes, I can float, but I can only float in this realm, of ICU, cardiac ICU, surgical ICU, ER. ER, generally, there's not much floating for ER unless their ER is divvied up into an urgent care section and a fast-paced section and the trauma section. And if you're not trauma, they need to know that if that's not your special. There's levels, ER levels, is it 1, 2, 3? So, so you need to know, you need to explain to whoever you're recruiting, whatever recruiter you're working with, you need to ask them information about the hospital. And they may come back to you with two hospitals that are looking for ER nurses. Then you can go research that hospital yourself and find out, are they a trauma center, and what level trauma center are they? Is it an ICU, that maybe has, I don't know, how many patients in that ICU, different things that would help you try to discern if that's going to be a good match for you. Let your recruiter do a lot of that for you, but don't hesitate to go research yourself. So that's the first question, is about being nervous to travel. It's okay. Be nervous. It's okay. You'll do a good job. Your experience, that's great. And you're accustomed to a certain pace in the ER and the ICU. So, so you want to find something similar so that you perform best, optimally. Okay. Can RN make six figures? Yes. What type of RN is most in demand? Gosh, we've talked about that too. ICU nurses are always in demand. ER nurses are always in demand. Nurse practitioners are in demand, and gosh, where is my little notebook? Labor and delivery, absolutely, labor and delivery. I don't know where my notebook went to. We have done videos on this, which are the highest paid and which are the most in demand. But I'll tell you that ICU, neonatal ICU, ER, labor and delivery, OR is usually high demand. Nurses in general are in high demand, and LVNs and CNAs as well. Abu Shakar, how many years does it take to be a traveling nurse? Generally, they want 1 or 2 years. So you don't have to have been a nurse for, I would say 2 years is the average request, but sometimes 1 year. And many nurses have been nursing for a long time before they opt to travel. So they could have 10 or 15 or more years of experience before they venture out as a traveler. So each facility, each hospital, clinic, long-term hospital, whatever, will have their own requirement. But I want to say on average, 2 years, 2 years of experience. And it can't be 2 years 10 years ago. You took 10 years off and, paid attention to your art or paid attention to your family or whatever, and then go travel after 10 years of not working. That won't work. I mean, 2 recent years. Okay. Can nurses make 6 figures? The answer to that is yes. And hello, ma'am, from Lutfan Nahar. Hello, ma'am. How a heart patient can get on travel if he fell sick? So you're saying the nurse, how a heart patient can get on travel if he felt sick. Okay, so a nurse, any nurse, a travel nurse or a staff nurse, has to be in good health, has to be without any restrictions. See, I couldn't work because I have one arm that can't bear weight right now. So a nurse has to be healthy and without work restrictions. So if you were on assignment and you suddenly became ill, or maybe you have some kind of chronic health problem that is controlled by, lifestyle and diet and medication and so forth, but then you got ill while on assignment, well, it's a force of nature. You passed your physical, you got all your vaccinations, but as a couple of days or weeks into your travel assignment, you become sick. You can't be faulted for that. So if you're not well within a couple of days, if you have to be hospitalized or you need weeks to recover, the assignment would have to end early, which would be very, very sad for you and for the client. They'd have to go through the process of finding somebody else, and it usually takes several weeks to do that. But if you became sick, if you had a heart condition and became sick while you were traveling, you have to take care of yourself. That's the answer to that. And you wouldn't be penalized. You wouldn't be paid. That's something to ask the recruiter as well, if there are any sick days for travelers, because usually on staff there is some PTO, they call it paid time off or sick time off, that may or may not apply to a traveler. Usually the way I recall it is that if a traveler got hurt, things happen, they could fall down and hurt their foot or knee or arm or whatever, and that could lay them up, usually for a few days. If you're just bruised and it's just a few days, that's understandable, and you can reschedule and make up the days as best you can. But if you're quite ill, the assignment would probably have to end early, because the hospital needs you. They need you. They hired you for full time for a certain amount of time. So if they lose you for more than a day or 2 in a row, or 3, that might have to end the contract. Let's see. Hi, Alex Hill is checking in. Hi, Alex. Where are the highest paying travel nurse jobs? Gosh, I've talked about this before. I think Los Angeles is one of the high ones. I wish my notebook were nearby. Ah, there it is, hiding behind my second computer. I'll look it up, Alex. Hopefully I can tell you where the highest paying travel nurse jobs are, because, yeah, there are a lot of jobs in Texas. I know that. There's a lot of needs in Texas. Are they the highest paying? I don't recall, but I'm going to see if I have some notes on that. Taposhi Rajak, is it comfortable to start a travel as a patient of heart disease? So two people asking me about heart patients. Are you saying that you have a heart disease and you wonder if you could be a travel nurse? I would say if your heart disease, like hypertension or some of the other chronic vascular problems, heart disease, even some of the heart failures can be very, very well controlled with treatments, various treatments, pacemakers, defibrillators, medications, lifestyle. You know, quit smoking, for God's sakes, if you have a heart problem. At any rate, I'm just being a little funny. I think I'm being a little funny. Anyway, if you pass your physical, if you're healthy and well enough to get a good grade on your physical exam, because most companies will require, in addition to all the credentialing, they will also require a physical and copies of current vaccinations, and that you're free of tuberculosis and smallpox. You know, you have to be in good health. And we all have something, you know. I have a little touch of asthma, and I have sensitive skin, and blah, blah, blah. None of us get through this life, you know, unblemished or without something. And so if you are healthy and deemed healthy by a routine physical by a physician or a physician assistant, you can, you know. Nursing is rather demanding, so you have to really be pretty physically fit and without any restrictions like this, right? You can't have a broken leg or a broken arm and take care of a patient because they need you assist them. I'm actually, it's an unfortunate side effect of my injury is that I can't help my mother as much because I can't move her wheelchair. So my husband's on demand much more. And so I hope that helps, Taposhi. Is it comfortable to start a travel as a patient of heart disease? I would say yes, unless you have a physician that says you can't go in airplanes and you can't drive for more than a couple of miles. So I need more information, but I would say I think so. I think so. If you're healthy and your hypertension or whatever kind of heart disease you're talking about is managed, I would think so. You could travel and be comfortable. You'd be as comfortable traveling as you would be at your current position. I'm assuming you're working already as a nurse or a therapist or a technician. So David Hodge, hi David. Hello. How do organization measure job performance? Oh, okay. So all hospitals in the U.S. are using a guideline to see if they're doing a good job with their patients, and so measure job performance. But maybe your question is about judging your job performance while you're traveling. That could be reflected in the general hospital evaluations, but how are they going to evaluate you would be the hospital. The hospital would give that information to the travel agency. Maybe more than once, you know. I think usually within if you're on a 13-week assignment, I would say within the first 3 or 4 weeks, they would be looking for some kind of evaluation and communication. The recruiter should be calling the facility and say, oh, we sent Alex, or we sent David, and how are they doing? They're traveling over there in your ER. We hope that they're extraordinarily exemplary and you know, completely satisfactory and meeting all the criteria. So there's communication between your travel company that hired you and the facility that is utilizing you. So that could be happening every shift you work, for in some cases, and some cases not so much, but hopefully, you know. And I always think no news is good news, but if you're concerned about it, you can always ask. You know, if you have a supervisor or a manager and you see them from time to time, you could ask them if they have a moment to speak to you. That might be a busy moment. They go, no, I'm on my way to do something, but I'll be back in my office in an hour. Come on by in an hour or give me a call. You could check in with the manager and say, hey, I've been here, gosh, I think this is my 7th shift. And I just wonder, is everything going okay? I mean, I really, really like working with the other nurses and doctors here. And it's a pace that I'm very comfortable with. And your systems are really easy to use, blah, blah, blah. And so, David, you could always check in yourself. If that's what you're asking me, you might be also asking me about the, not the HIPAA, the evaluations that are done, that are sent to patients, and where they evaluate. Were they treated courteously? Did they get enough information? The doctor, the nurse, and all that. You might be talking about that. I'm not sure. Let's see. Razak Abdur, what I would expect from an ideal travel nurse? That's a great question. And Moklesa Khatun, hello, dear. How do I prepare to be a traveling nurse? Okay. Okay. So Razak Abdur, what would I expect from an ideal travel nurse? You would expect somebody that is not only skillful, but works cohesively with the team, that is on time, if not early, and is meeting the expectations you had. You know you've got a good nurse when you wish you had 2 of the same nurse, okay? So a travel nurse is a nurse, okay? So you evaluate your travel nurse just as you would a staff nurse. Certainly it might, you know, they might not be fluid 100% in everything, because they don't even know where things are. They have to figure out where things are kept. They have to figure out, is your charting different than the charting they were accustomed to? You know, they have to acclimate. But if you have somebody that's really sharp, they're going to acclimate pretty quickly. They're not going to bug people with questions, but maybe make a note of them. And when they have a meeting with a charge nurse or a supervisor, check in on a few things that they feel that they'd like a little bit more information on. Maybe they picked up things in orientation that help them. So a good travel nurse is not only somebody that's skillful, but someone that acclimates, that works well with the team, that has a great disposition, that offers, that actually brings something to the table when they're working, and yeah, and is timely and dependable. Dependable. Dependable is a great word, and that's what you look for in an employee, even a temporary travel employee. Moklesa Khatun, hello, Dia. How do I prepare to be a traveling nurse? Okay, so a lot of it depends on you. You need to. So okay, you have experience. You're an experienced nurse, right? Let's say you've been nursing in with medical surgical patients for 5 years. And in addition to that, you spent some time on an oncology ward. So you're very accustomed to a variety of medical, surgical, acutely ill patients, and you decide, I really want to travel. It's so cold here where I live. I want to go someplace warm, and you decide to travel to Texas or to Florida. And what you do then is you find the best companies, and I can look them up. I can see if I have them in my notes. Oh, I'm going to backtrack here. Who was it, David? How do organizations measure job performances? I wanted to mention the HCAHPS, HCAHPS, HCAHPS. That is something all the healthcare facilities are using, and it stands for Hospital Consumers Assessment Healthcare Providers Systems, HCAHPS. You know, I had that on a big board. I'll try to look at that while I'm talking to you. I'm fortunate that my office is rather small, and I have a lot of things. Like I could just reach to the left, reach to the right, reach up there, and find things. Let's see if I have written HCAHPS down. I'm sure I wrote that down at one point. And then I could tell you, yeah, look, HCAHPS. What are these little notes? Hospital consumer, oh yeah. Hospital consumer assessment of providers and systems. Okay, so patients, sometimes while they're still in the hospital, but more often when they go home, will get a message from where they were, where they received treatment in a hospital. I think many hospitals and skilled facilities should be using it. Okay, and then the CHAPS, what do we call that? CAPS. Instead of the HCAPS, just the CAPS. The CAPS is the Consumer Assessment of Provider Survey. So between the survey, this is what the survey is, what goes to the client, to the patient, and the HCAPS is the explanation of how the organizations are being evaluated. So I don't know if that was your question, David, or if you were asking how individual travelers are evaluated. And that performance, it would be reflected. It would be reflected in the survey over a period of time, right? So if you were one person at an organization and they quarterly, I think, or checking those surveys, reporting on their surveys. So if you were a traveler there during one of those quarters and their grades were very, very good, maybe they went up, that reflects on you as well. But if you're asking about how do they measure your job performance individually, that would be supervisors of your whatever unit you're working on, whatever facility you're working on, communicating that back to your travel company. Now, what else was I looking for? How do I travel? To expect oh, the highest paying travel companies. Do I have them listed? Do I? Do I? I'm sorry. I think I have them written down somewhere. There's a lot of technical stuff. Travel occurrences. I don't know. I'm not finding them right at the moment. Who the top 10 or the top 5 are. We did talk about it. Maybe I just didn't put it on one of these cards. Ew. Okay, so where is that question? Where are the highest paying travel nurses? I will let you know on Thursday when I come back. Why I don't remember that. Figures don't stay in my head. I always have to go back for figures. So, did somebody else check in? Hello, ma'am. How can we get treat for small kids if severe sick on travel on behalf of doctor? And then Rajik Shoykot, please mention some critical physical issues that will make a negative effect on traveling. Well, Shaneen Akhtar How can we get treatment for small kids who are severely sick on travel on behalf of doctor? Okay, so you're saying you're maybe a family and you're maybe the head of household, the doctor is on a travel assignment and you've brought the family with you. You just have to seek, I mean, small kids, severely sick. So you have to take care of your kids, you know. So those would be questions to ask if you're traveling with your family. Number one, do you have your own health care insurance, or does the travel company provide? They usually will provide health care insurance for the traveler during the 13-week or whatever the amount of the assignment is. It could be 6 months or whatever it is. I'm shaking my pen here. Sorry about that. But there could be options for you to get health care. I actually, thinking back when I was a clinical manager, I had a nurse who was traveling. She had twins, and she was the traveler. Her husband was taking care of the children, and they did need medical care, and they had health care insurance. So I just guided her to either go with the facility she was working at, I believe it was a Kaiser, or just go whatever was convenient and local to where they were housed, you know. So, you know, having health care insurance is the best way to take care of small kids when they get sick. And you can either, continue your health care insurance that you have, seek some if you don't have it, and then if your family member is traveling as a doctor, he can ask what kind of benefits are there for the family, because usually they will take care of the traveler who is their employee during the time of travel, and offer opportunities to bring in family members. So that's very unfortunate that if that would happen. But you know, there's no guarantees, right? You know, you take good care of yourself, but then you have an accident. You take good care of yourself, and then you know, you've inherited some healthcare problems through your genes or something. So there's no escape. That sometimes we get ill, and that's why we're in healthcare, because people need us, but we're human too. So sometimes we get ill, and our children get ill, or grandparents get ill, and that's life. So you just be prepared, I guess, is the best way to answer that, and ask those questions before you accept a travel assignment. Say, you know, I'm the traveler and I'm the doctor. I'm not. I'm just saying, if I were the traveler and I was the doctor and I was looking at traveling somewhere, I would talk to the recruiter and say, look, I have, 3 children and my wife are going to be traveling with me, or I'm the doctor and I'm the female. My husband and my 3 children will be traveling with me. I would like them to be insured as well. What do you offer? What do you offer? And what would be how much would it cost me? Right? And then you can compare it. If you already have health insurance and it seems like a good deal, you could switch over. So, okay, let's see. Razak Abdur. Oh, you wanted to know about the ideal travel nurse. Why do travel nurses get paid more? They don't necessarily get paid more. It's going to vary. It's going to vary. Certainly, we talked last week about crisis pay, and that is higher, and that does come from time to time. During COVID, there were probably some crisis rates, and there were probably some just regular rates. Nurses are already planning their travel assignments. So you have to determine, it's a choice to travel, and there are some good rates, and there's always that bonus that you get to see places you might not otherwise have been able to get to and visit, like New York City or San Francisco or Alaska, so they may or may not get paid more. Actually, when it all works out, it's pretty similar. There are things that are choices, right? So if you take a staff position, and some people, I know nurses that have been on staff for pushing 30 years, and they still are happy. They're happy with their organization. They've grown in their career, and they do great work, and that works for them. But what comes along with that 30 years? They were probably on a pay scale, so they probably got incremental raises in their pay. They get paid time off. And if they're very, very healthy, then they can maybe accumulate sick days and get an extra day off. They may get a gold watch after 25 years. I mean, and they have a lot of security in a job that benefits you and rewards you and continues to employ you for 10, 20, 30 years. So that, you can't quite measure that with a travel assignment where the nurses may be getting $50 an hour and a nice place to stay and the opportunity to visit a new city. Looks attractive and so forth. But then when the travel assignment finishes, it may take weeks or months before the next travel assignment. You know, if she's not on the ball, he or she's not on the ball, and the recruiter's not on the ball, and they're not communicating, and the assignment ends October 15th, and they don't have the next assignment available, and they go grappling, and the next one's not coming up till late November, then there's no income between October 15th and November 20th, say, okay? So you have to prepare for all that. You still have to make a car payment. Maybe you own a home in another state, you know. So it's a choice. Traveling is a choice. Yes, there's some good money, but it requires a lot of attention. If you want to do it year-round, you better be organized. You better have a great recruiter and be flexible. You know, you may want to be at one particular hospital in a certain town that you've been to before, and all of a sudden they have a drop in census in the middle of the summer, and so they're not bringing in any travelers for the fall. So, but I wouldn't say travelers get paid more. They get paid an enticing package usually, and it's a choice. And I wish I'd done some of it, honestly. Let's see. Taposhi Rajak. What basically travel nurses do? Okay, travel nurses do what nurses do. The difference is that they're coming from somewhere else and they're staying close to where they're traveling, where their assignment is, and they do what any nurse does. They do all the nursing process and the assessment and the treatment. A travel nurse is a nurse. I feel like I've been babbling for quite some time. I have. It's almost 3 o'clock. Thank you so much, everybody, for checking in. And I'll be back Thursday from 2 to 3 p.m. Pacific Standard Time. And I will answer the question that I didn't get to, which was the highest paying travel nurse jobs. I'll come up with some statistics for you as far as money, and you can weigh it out yourself. But keep in mind, travel nursing is a choice and works out really well for nurses that give it a try. And you want to know, Alex wants to know where the highest paying travel nurses are. And where the highest paying travel nurses jobs are. Okay, the highest paying, that's one. And I'll try to let you know. At least I'll narrow it down to a city and or a state. I may not be able to come up with a specific hospital, but there you go. Okay, stay well. Thank you for tuning in, and I'll see you soon, everybody. I hope I got all the, I think I got all the questions. Thank you.